So in your experience, how big is the problem of patient dropout in physical therapy?
Yeah, I think this is something that I don't think enough PT clinic owners focus on. I think the main focus is typically on patient acquisition. Anytime that schedules aren't full, I think people typically tend to focus on how do we get new patients in the door versus focusing on the existing patients. Basically, the problem of patient dropout is massive. 20% of patients drop out within the first 3 visits. 70% don't finish their full course of care. And the bigger your practice gets, the higher the dropout rate is. That's just how things are in the industry. And I also think people don't realize how a small change in your dropout rate and retention can actually impact your bottom line. Like something like a 10% increase in your retention, it may not sound like a lot. Like that's going from an average visit of 8 visits per patient to 8.8, for example. Like it doesn't sound like a ton, but then that, if you do $120 in eval and like $105 per visit, a 10% retention, if you're doing about 1,000 visits per month, that's over $125,000 a year in revenue, just from going from 8 visits to 8.8. So it's significant. I mean, that's enough to hire another PT and expand, and you can do a lot with that. And that's just 10%, and that's going just from 8 to 8.8. So now imagine going from 8 to 10 visits per patient or 8 to 12 visits per patient, which is really what people should shoot for. And that's not even to mention, if somebody gets from, rather than dropout, they get to discharge, they're likely to have had a much better experience in the practice. So then they're likely to refer their friends, they're likely to refer their family, they're likely to return for future care. So if you lose it, if it's a dropout, it's not just that you're losing 2 to 4 visits. You may be losing, all the other people who may have gotten a referral if that patient had the best experience possible. So to me, I think it's the number one thing that people should focus on. You have to make sure you're maximizing the patients you have before you can start looking for new patients.